Good morning, everyone. Thank you for joining us virtually on this Monday morning. Um, as Devin said, I'm Jess Epsten. Happy to be here today with Sarah Kramer.
Hi, good morning. It's great to talk to you about this.
So we have a lot of information to share. We're gonna try to move through as quickly as possible so we can also get to some question and answer. If you have questions, go ahead and put them in the chat, or if you have resources or ideas to share, please do that as well. We know as a group library staff, we're very eager to share information, so we're happy to learn from you all as well. So I'm just going to go ahead and jump right in, and I'm sharing my screen, so hopefully this will go smoothly. So I just wanted to just get on the same page, sort of like why are we doing this presentation? So it's obviously a very important ongoing topic around public health and especially in public libraries and well, all libraries being a public space. So but we really wanted to give you all a place to start and give you all a practical roadmap for developing harm reduction programs in your libraries. This is also, if you're just wanting to learn more, it's a great space to do that too. And just want to be clear that while many conversations might focus on sort of the debate whether libraries should or should not carry naloxone and Narcan, this presentation is really going to focus on the lessons that we've learned from proposing and planning harm reduction programs. Harm reduction programs can look very different. There's many different things you can do, but we're going to talk specifically about how we are working to get Narcan or have gotten Narcan and naloxone into libraries in case of an overdose.
I'm just going to talk a little bit about our time together. We're going to do some definitions so that we're all have the same understanding of what we're going to talk about. And we're going to familiarize you with some important information and data that you'll want to use if you decide to embark on this process. We'll talk about the library context of why you want to have or consider having Narcan, naloxone harm reduction in your library. And then most of our time will be talking about how each of us and our library systems went through our processes and approaches. We'll do a Q&A after, and just as a content warning, this can be a difficult topic. We'll be talking about death and statistics related to opioid overdose.
So as Sarah mentioned, we're gonna just do an introduction to opioids, harm reduction, and naloxone, just so we can again get a little context and we can all be on the same page. So these are some text-heavy slides, but I'm gonna run through them. I think it's important to start with definitions because the understanding of these issues are really changing, and there's a lot of stigma that we want to dispel as library professionals as well. So first, starting with substance use disorder, and this comes directly from Durham County Public Health. So a substance use disorder is the use of alcohol or drugs that is a chronic relapsing disease. And I think this is a good one to start with because this understanding of this has changed a lot in the last few decades. So what was once seen as a personal or moral failing has really shifted in to a better understanding of the complexities of substance use disorder, taking into account someone's life experiences, the structural inequities, as well as the context of, drug companies and overprescription of opioids. And I want to make it really clear that substance use disorder and overdose impact people across age, race, class, gender. It just really does impact all communities. It might impact them differently, but it is impacting all communities. So what are opioids? They're a class of drugs that include pain relievers available legally by prescription, the illegal drug heroin, and synthetic opioids such as fentanyl. So opioid pain relievers can be very effective for treating pain. However, regular use can lead to dependence, and a misuse of opioid pain relievers can lead to addiction, overdose, and possibly death. So another really important definition that we're going to be mentioning a lot today is harm reduction. So this comes directly from the Harm Reduction Coalition here in the state. They're an amazing resource. Definitely encourage you all to check them out. So harm reduction is a way of preventing disease and promoting health that meets people where they are, rather than making judgments about where they should be in terms of their personal health and lifestyle. So this is really just about focusing on what we can do given someone's current realities instead of making judgment. So harm reduction, though usually is talked about in the context of drug use, it also is something that we probably do every day, right? So I like to give the example of wearing a seatbelt, right? I want sometime in our point in our history, we didn't have seatbelts, and now we all wear them. We don't even think about it. Wearing a bike helmet, getting tested for STIs, consuming water while you are out at a bar, drinking alcohol. These are all harm reduction practices. But they also include things that are specific to drug use, which is could be needle exchanges, fentanyl test strips, medicated assisted treatment, and things like that. So just really quick, what is naloxone and Narcan? Just want to be clear that naloxone is the main name. It's the life-saving medication that can reverse an overdose from opioids, including heroin, fentanyl, and prescription opioid medications when given in time. There are two forms of naloxone that can be used without medical training or authorization: pre-filled nasal spray and injectable. I think they're working on, well, I think there is one that's more close to like an EpiPen as well, but these are the main ones. So naloxone is the sort of just basic name, but then there are brand names like Narcan, which is a nasal spray, but there are plenty of other brand names. So we'll sort of be using these things interchangeably, but when I talk about, I think when Sarah talks about Wake County and I talk about Durham County, we'll be using Narcan because that's sort of what we decided on using in the space. Oh, you're muted, Sarah. Oh, your mic isn't working. Oh, is it back? Try again. Can't hear you. Oh, now I can. Oh no, sorry, Sarah. It's really muffled.
Okay.
You sound kind of underwater.
If you have headphones nearby, you might want to plug in some headphones.
Still sounding underwater.
Okay. That's what I would say together. And okay.
Do you want me to keep going and you want to log in, log back out? Okay, cool. I'll keep going. So, most of you are probably aware that we have been and are in the midst of a severe opioid crisis. Opioid overdoses are one of the leading causes of death in America. Again, like I said before, it impacts all different demographics. These are just some data points from the CDC. So the increase has been nearly 30% from 2019 to 2020. And then has even increased, I think, a lot, especially since the pandemic started because of the isolation and of their impacts of the pandemic. And also, I think this is a really important quote from the CDC that for every drug overdose that results in a death, there are many more non-fatal overdoses, each one with its own emotional and economic toll. And then also just making a note that 220 people die each day from an opioid overdose. How's it going, Sarah?
All right, can you hear me now?
Yes, you're back.
Okay, perfect.
Okay, I'm passing it back to you. I hope I did that slide okay.
Thanks, everyone. So over time, there's been 3 waves of opioid overdose deaths over the past 30 years. The first wave began with the increased prescribing of opioids in the 1990s. So this was with OxyContin, oxycodone, kind of when you think about the rise of the marketing of those pain pills. And that increased throughout the 90s and since at least 1999, where we saw the big jump. The second wave began in 2010 with the rapid increases of overdose deaths involving heroin as pharmacies began cracking down on prescription overuse. So people turned to street drugs at that point for that area. And then the third wave began in 2013 with significant increases in overdose deaths involving synthetic opioids, particularly those involving fentanyl. And the market for fentanyl continues to change, and it can be found in combination with heroin, counterfeit pills, and cocaine. So sometimes when you see high school students or college students encountering this, they think they're taking one thing, and it turns out to be fentanyl or counterfeit pills. The majority of overdose deaths involve opioids. And there's also been an increase of deaths involving synthetic opioids like fentanyl and stimulants like cocaine and methamphetamine, and that's increased as well. And a big accelerant for overdose deaths was during the pandemic when people were isolated and home alone and didn't have as many intervention options. In terms of North Carolina, 28,000 North Carolinians lost their lives to overdose between 2020 and 22, and just sharp increases, 22% from 2020 to 2021. And 90% of those overdose deaths are unintentional. So harm reduction can really have an impact in helping to save lives. Locally for us in Wake County, when we were doing our research on our harm reduction program, in 2022, Wake County EMS responded to over 800 overdose incidents in that year.
So I'm going to talk a little bit more about naloxone and Narcan because I think there is some misunderstanding and some myths around that medication. So naloxone is a medication that reverses an opioid overdose caused by, like I said before, pain medication, heroin, or fentanyl. It works to reverse opioid effects on any opioid at any time. It does cause sudden withdrawal that can cause agitation and be uncomfortable for the person. It's mostly just confusing for the person, but I want to be clear, it's not a stimulant and it has no effect if an opioid is not present. So if someone passes out and doesn't have an opioid in their system and you give them Narcan, nothing happens. And it has no psychoactive effects. It's not addictive. It's routinely used by EMS and first responders. Many police departments and sheriff departments carry it. I also want to be clear that it does not replace first responders. It just gives first responders the time to arrive. It's very much similar to having an AED machine. One of our safety people in Durham County would say it's like having a fire extinguisher. You know, you need it, but you're still going to call the fire department if there's a fire. So it really is basic first aid. And in the last few months, it's now over the counter. Unfortunately, it can still be very expensive, but nowadays, because of the opioid settlement, which we'll get into a little later, you can get it from many public health departments for free. Some counties and cities even have vending machines where you can get them for free.
I'm going to talk a little bit about another concern that your library staff or management might have, which is liability. And I just want to talk a little bit about the legal protections that your library staff will have. There's Good Samaritan laws, the North Carolina Naloxone Access Law, and you basically have similar protections that you would around the ones that you have if you end up using an AED machine on a patron. So because you're helping to intervene, you're protected by law. And it also protects individuals. So if a patron ends up being the one administering the naloxone, there's protections around them as well. So it's one of those kind of good faith laws. And I know that some of our staff had a lot of concerns about this when we started discussions around this. So just wanted to let everyone know you're protected by law.
So just a little bit more context of what's going on right now. The opioid settlements are there's many multiple national litigations that have been taking place against drug distributors and manufacturers for their role in the opioid epidemic. There are a lot of funds coming to North Carolina that have already come to North Carolina. So in this first wave of settlements that I believe started last fall, it's over $1 billion coming to North Carolina, with 85% of those going directly to counties and municipalities. And as of last fall, all counties and municipalities have formally joined the settlements. So this is and we'll share some links and resources later to where you can sort of get some data and see how much your county or area has gotten and who might be in charge of that funds. Many counties are hiring specific people to manage these funds and programs. So there are probably a lot more resources now than there were a year ago to support with these sorts of programs. So now we're going to talk a little bit about the library context. I'm not going to spend too much time on this, but I think it's important to sort of show how we approached some of our leadership in talking about this. I think it's important to just remember that libraries of all types, including public libraries, have worked to disseminate health and medical information for a long time. Libraries have partnered with public health departments to do child care education, medical screening, testing, wellness education, and also disseminating different supplies, COVID tests, safer sex supplies. So this isn't necessarily new to many of us. And then why Narcan at the library? So Narcan is safe, effective, easily administered. Again, gives time for EMS to arrive. We know, libraries are a public space. There is potential risk for overdose on the premises. And also, it also often fits within larger community and state public health goals, whether that's reducing stigma or reducing overdoses. We'll get into that a little bit later. And then also just a reminder that many libraries are already doing this across the country. So you're not alone. You're not the first. There's lots of other people who are doing this. But I also want to be clear that libraries, public academic community colleges, we can't solve the opioid epidemic, but we can reduce the harm it causes by making Narcan available alongside the necessary training. So again, it's classic library, it's about having the tools for the public and the staff and being prepared to be part of the solution. Okay, so now we're really gonna deep dive into our process here. And again, we're talking in the context of urban public libraries, but I just want to say this is a real issue for any library. As Sarah mentioned, especially on college campuses, there are worries of overdoses everywhere. So, and just before we start, I hope this is helpful because both of us sort of took different approaches, but we were also supporting each other throughout this process. So at Durham County, we took a more bottom-up approach, and Wake County took a more top-down approach. And so hopefully that will give you some ideas of different ways to approach this. So in order to make it a little bit more easily to follow along. We've put things in these linear steps, but I want to be clear that this process is not necessarily linear. We also have a handout that we will share with you all that writes all of this stuff down. Feel free to take notes, obviously, if that's your learning style, but just letting you know that you won't lose this information. So the first step is really about gathering data, finding your allies, whether that be in the library, in the county, in the community, and also sort of gauging your capacity and setting a timeline. So with Durham County, there really wasn't much data specific to the library. It was just a lot of incidental, anecdotal from staff. People have been finding needles, having trouble waking people up, um, staff just being nervous. There's just like a lot of conversation between staff. Luckily, we started making connections early with EMS. We were able to get more data. And then let's see, let me just go ahead and, well, no, I'll finish and I'll pass it to Sarah. So we decided not to, why it says staff surveys question mark, we decided not to survey staff at the beginning. We wanted to sort of create a core team and sort of figure out, do some more research before we asked staff. There was some concern that if we asked staff like, hey, do you want to do this? There would be an immediate no, because of just there needed to be more information and education. So we started with reaching out, identifying internal library structures. So we had a safety committee at Durham County Library, so we started there. That helped us to identify the external structures to the library. So we reached out to the public health department, to the person who was doing all the substance use programming in the county. She connected us with the community EMS people, who also then connected us with the risk management and safety department. So it sort of we created a core team in that way. It was also really great timing because, as it says, and identify external structures, our community EMS department had actually received a grant already from, I'm blanking on where it was from. Oh, the substance. I'm not going to remember the acronym, but they had received a $400,000 grant to train people in the community who might basically train librarians, train community members, train folks who are working in sectors that might be around folks with high risk for overdose. So we were really lucky in that way. But again, it's just identifying who's working on it potentially in the library, who's working on it outside of the library within the county. I'll pass it to you, Sarah.
Yeah, in Wake County, we started with a working group, and one of the first places we went to was the county health department, and your county might also have a pharmacy, and they were really instrumental in giving us related data to Wake County that helped inform our planning process. We were also responding to incidents that were occurring in our libraries, so some overdoses, finding needles, similar situation. We ended up doing a staff survey, but you really want to be careful with how you word it so that you don't end up with a no as a foregone conclusion. So we started with information gathering on the level of knowledge our staff had about harm reduction, and also if they would be interested in training. So we didn't get into whether they'd be willing to administer, just more about their openness to learn about harm reduction, to learn about Narcan. We kept it very simple. It was only a couple questions. And then we included a separate box for questions, comments, and concerns. And that was really helpful. It was anonymous. And we shared the results back with staff so that we could create a transparent process with them, just as a way of getting buy-in. And we grouped the comments under general topics rather than verbatim, just also to protect staff identity. And I think that was really helpful because we could kind of see different trends. Like some people were really concerned about mission spread. Some people were concerned that we weren't doing it already. So it was really, really helpful. And then we reached out to county leadership, we reached out to nonprofits, and we just kind of gathered all of our potential partners and folks that we would be either need to work with or want to work with in the future.
Great. So exactly like Sarah said, the next step is a lot of team building, collaboration, figuring out who's going to be on your team. Also, like I said, reaching out to the community, like the North Carolina Harm Reduction Coalition, because they are the experts in the field. And this took a lot of time, right? I mean, everyone's really busy. I want to make a note that, I think Sarah and I are both doing this on top of our other job responsibilities. So, take that as you will. It's right. It's complicated when we take on other projects. But that's why it was really important to develop a strong team, because it was easier to share responsibilities. The next part that I would really recommend is looking sort of when you're starting to build your case of why you were going to do this, other than what I shared before is, here are all the reasons, but think about how does this fit into existing goals? So Durham County has a strategic plan, goal 2, it's health and well-being for all. So that was really helpful to say like, okay, we're not doing something wild here. This really does fit into the county's goals. It also was really helpful for us that EMS had that grant, and public health had already all these programs going on, so we could really show that this was a continuation of the county's ongoing projects.
And
go ahead.
Sorry.
No, go ahead.
Yeah, this was also very similar in Wake County, fitting the goals with our broader county goals. So our county has a set of shared goals, and promoting health and well-being is one of those.
Yeah, and I think that was really helpful in this third step here with this creating a plan and proposal, because we always could look back to that goal and say, okay, how is this fitting in? We also, I will say, like, we put together a proposal, we put together a presentation, and we had to sort of constantly be tweaking that depending on our different stakeholders, depending on who we were presenting to. I'll go into a little bit about those presentations in the next slide, but our goal in Durham County, we had 2 main goals. The first was harm reduction and overdose awareness training for the staff, and having Narcan available at the library in case of an overdose. That was our main goal. And then the second goal was to do the same, but for the public. So just increase the number of Durham County residents trained to use Narcan and naloxone. Again, help with that stigma and give training to the public.
For us, one of our big goals going forward, so we're still in the process, is providing adequate training. So we do have a proposal that we're waiting to get approved from our county stakeholders. And we also did a presentation that if we did it for the county attorney's office, we would highlight certain aspects, versus our presentation we did with staff, which had a different set of concerns. And I know it takes more time to do multiple presentations like that, but I think it's worth it to be really intentional of how you're presenting your messaging, because different folks are going to have different interest areas, or they're going to have different concerns based on what their role is in your organization.
So yeah, as Sarah said, it was a lot of presentations to groups and tweaking those presentations to different audiences. I should have mentioned before, I think that once the idea was planted and we first presented to the library safety committee, which was our our first presentation, I want to say the process probably took us over a year. And I think that nowadays with the opioid settlement funding, it could potentially go faster just because more people are in the know. We were doing a lot of education on the ground to folks in the county, to folks in the library, again, constant training. But as we know, some local government can move slowly. And so, we were just patient. But yeah, so the first presentation we did was to the safety committee within the library to sort of just get the blessing to keep researching and building the team. Once we did that, once we created our proposal, we circled back to the safety committee and then gave presentations to county legal and county safety. So that was sort of we really had to refine the plan a little bit there. I think there was a lot of confusion for us just talking about like a potential obstacle is figuring out how library security would be involved. For us, it was sort of it's complicated because we at Durham County contracted with security. So that can be a little bit tricky, right? Because they already have these really in-depth contracts already set up. It's not as, it might be a little bit easier if you are working with, say, the sheriff's department or someone else who is already part of the county. But our team, including county EMS, county risk management, we sort of thought it was a no-brainer that the security would also carry Narcan and help administer it. But the contracted company was really against it, which was, I would say, surprising, a little frustrating. I would say that individual security guards were very for it, but they were the supervisors were not. So that was a little bit of a disappointing setback because technically they are first responders. But you know how this goes, where you're sort of like, okay, how are we going to figure this out? What we landed on, what I really pushed for was, I was like, look, I'm seeing in the field where the security officers, they're not even aware that like people are having near overdoses. Like they're like, oh, this person's just asleep. I was like, that person's not just asleep. So we agreed that security would take trainings on just overdose awareness. So again, that was a little bit of a setback, but county legal was actually very, very supportive. They were very understanding of the Good Samaritan laws. So once we sort of refined the plan, we circled back, we presented to library leadership, and then we presented to staff as well.
Yeah, again, we took it first to our leadership advisory team. So our director, our assistant director, just to make sure we had their buy-in before proceeding. And then we needed to take it up a level to our county structure because we're a county department in Wake County. So they also needed to be aware of what was going forward. I will say the opioid settlement has been a game changer because they've hired someone to be our settlement contact. So we met recently with her, and it was super helpful just to kind of figure out how we fit in the larger framework of a county-wide plan. So going forward, you might have an easier time working with this project because there is that statewide settlement money, and a lot of counties really want to make sure that gets shared fairly across their counties. So just keep that in mind and see if you can find your contact in your county who can help you with that. Another thing we did as we refined our plan and went through the planning process is we reached out to probably several dozen other library systems across the country, and they'll share their policies with you if you ask for them. And a great question to ask them is, what do you wish you knew before starting your process? Because a lot of different systems did it in different ways. And we got a lot of good information about issues with presenting the message, where they may have misstepped with staff, or here's a best practice for storage of Narcan. So it's super, super helpful and really worth the time. So if you have a team working on this, you can assign different members to do informational interviews, and that really helps with creating your policies and processes. You don't need to create it from scratch. You can use what other folks are using.
Yeah, great point, Sarah. We also reached out to folks, and again, in the resource handout that we'll share, there are contacts and as well as presentations by folks who have been doing this for a long time. We ended up doing most of our policies and processes through, again, that safety committee at the library, since that is really fit within their role. Depending on the structure at your libraries, it might be more formal, it might be less formal, right? A smaller library, it's probably a lot simpler to say, okay, we're just gonna check the expiration date, or have like the expiration date on the Narcan listed on the calendar, and we'll go from there. We were really lucky to also have a strong risk management team, and I'll get into a little bit more about how the program was set up and how we sort of finalized the logistics. So, implementation and training on the program, we, again, because of the opioid settlement funding and the grant that our EMS got, we were able to source the Narcan directly from our public health department, and it was free. So really this program ended up monetarily being free, time-wise, lots of time, not free, but we worked again with public health to figure out, okay, how many kits do we need at each location? We decided that it made most sense to have at our main library, we had 2 kits per floor. We had additional 2 kits at the other 5 locations. We also had a kit at our Techmobile and our Bookmobile. We decided to store the Narcan with the AED machines because it's a prominent location. It's well labeled. An AED machine might be needed in a medical emergency like an overdose. It was available for staff and patrons. And we also, again, like I said, we had wonderful support from our county risk management department, and they already checked the AED machines monthly. So they just added that to their monthly checks to make sure that the Narcan was still there, was still in date, as well. So let's see. This is actually the point where we did our survey. We had presented to staff that, we were working on this, but this is the part where we did our survey to sort of see, okay, how many people want to be trained? This would help us really got with our logistics of how many trainings did we need. We realized that it would be easiest to have it during a staff day because that's when like everyone's in one place. But then we also set up a schedule to have multiple training opportunities at the locations as well. So we decided the training, the way that we were able to get this moving forward is that the training would be optional, but everyone was encouraged to attend. And we made it really clear that attendance would not mean you would need to like say, yes, I'm going to use Narcan in case of an overdose, because a lot of what happens during the training is that just basic education about harm reduction, about overdose, about opioids. And I remember during the training, it was really awesome. I want to say we had over 90 staff members there. And, I know that some of the people there in the end were like, okay, I don't think I'm going to feel comfortable giving Narcan for various reasons, whether their own, physical needs or abilities, or just, maybe we had a lot of people there from like back of house staff, but they all were really positive and like asked a ton of questions as well. So the training was provided by the North Carolina Harm Reduction Coalition. Again, great organization, definitely reach out to them. And we also had county EMS there as well to answer questions. And yeah, it was just there have been other trainings since I have left Durham County, but that first training was very successful.
And this is a process we're in Wake County right now, so trying to finalize program logistics. For us, one thing we decided, so we still don't have it confirmed whether we will carry Narcan in-house or not yet. But what we did decide is regardless of where we end up landing, we're creating trainings about the opioid epidemic and about harm reduction that are going to be required trainings for all staff, regardless of where we end up with our plan going forward. And for us, we kind of see it within the context of like, this is going to be an ongoing issue in libraries. So regardless of people's comfort level of administering Narcan or whether they're willing to do it, we want all our staff to have a baseline level. The great thing about harm reduction is it's a continuum. So you could say like, hey, just being able to identify if someone is having an overdose or being able to know what to do when that situation occurs, like calling EMS, different roles, things like that. So I think if your system isn't ready for Narcan distribution or carrying it, there's other places where you can land that fit into that harm reduction continuum.
Absolutely. And I think, even though we've had some, near overdoses or some really dangerous situations at the library, since we implemented this over a year ago, there haven't been any overdoses, which is great. But at the same time, we were able to train, over 90 staff again, and just in that education piece and dispel a lot of myths. And I think that in and of itself is really, really powerful. So, the final goal here is again to continue to sustain and improve the program. Um, this is what's sort of in process in Durham County. I checked in with my friends and coworkers over there. The program is still under the safety committee, and giving trainings periodically during staff days. But yeah, this again, how do you keep track of your successes, obstacles, lessons learned? Ideally, right, completing regular assessments, surveying the staff about the program, seeing what maybe needs to be refined and update the program as needed. So again, as official as you can make it, probably well, it's complicated, right? It's good to have things official in place just in case people like I left the program, but I knew that it was going to be okay because it was still under the safety committee. So getting that formalized so that that it will continue with, it's not landing on just one person is key. Anything to add to this, Sarah?
The one thing I do want to add is have a maintenance plan in place. And one place where you can have a partnership is with doses of Narcan that might be close to expiration. So our NC opioid settlement contact was like, hey, we can set up a plan where we pick up the doses when they're close to expiration, send them to a place that's going to see them be used or distributed so nothing goes to waste. And that was super helpful because we had come up with this whole disposal plan, and it turned out like we could actually make sure nothing went to waste in terms of that. We also did a sample budget of what it would cost to maintain if funding changed or we were paying for it out of pocket. And I think like just being prepared for all of that is really helpful just to make sure your program doesn't die off in a year or two because you didn't plan for some of these contingencies.
Great. So just to end, we wanted to talk a little bit about, lessons learned. The first thing is finding your allies. The reason why this presentation exists is because Sarah reached out to me and said, hey, I heard you're doing this program. Can you help with Wake County? And so, yeah, we worked a lot together, helped each other, learned a lot from each other. Again, there are other organizations and libraries doing this. Public health are your friends. They have a wealth of information and practical advice. Um, Definitely, or sorry, did you want to add to that, Sarah?
Oh, yeah, and there's also folks who are already doing the work in your communities. So we reached out to county workers who work in our shelter system for our unhoused population, and they had some great tips, like some of our work overlapped, and that was super helpful too.
Yeah. And, you know, be prepared to confront stigma. Substance use stigma is still, and misunderstanding is still very prevalent. Be prepared to confront that stigma with others and in yourself too, as you learn, and, start to work with folks. It's just, this work isn't it's not easy, but just having these conversations is a really good place to start. And I just want to affirm, data shows that harm reduction works. Having Narcan easily available decreases overdose deaths by a lot. The data is definitely on the side of having these types of programs, having Narcan and naloxone readily available. I think one thing that I wish that I had done is focus on staff support early on. So I think we were so focused on we need this thing, that I feel like almost well, it was almost done. The program was almost finished, and I had so before the program was finished and finalized, I was just carrying Narcan on my own. And we had a situation where a man had passed out with a needle in his arm in the bathroom, and I went to go respond because I was the only person who had Narcan in the building. I was able to revive him with the sternum rub, which is when you get trained in Narcan, you'll learn about that. So that was really good, but that incident made me realize, like, oh, that was really intense. That was really, really intense for me and the other staff who were there. And so thinking about how can we prepare to support staff in responding to these things. And I also want to like make a note that I think this is a problem and a thing that goes beyond just this type of potential incident at a library. I think people who work in public libraries know that how we prepare for difficult situations and how workplaces support us is a really big issue, really in all libraries, and there's not necessarily like an easy answer. But I think at least having those conversations is a good place to start. Anything to add to that, Sarah?
Yeah, I'll just briefly mention two things for the staff support. If you're in management and you're the one initiating the program, this is like crucial, especially if you're not frequently like on the public service floor. So you're really, to get that buy-in, your staff are really going to need to feel like they're going to be supported in these situations, and a care process like afterwards to debrief or get them in contact with AEP programs, things like that, because a lot of the hesitation is tied to some of those impacts of being in a trauma situation and then not feeling supported afterwards. So just really, really make that part of the process. And I kind of talked about planning for the long term, but yeah, maintenance and planning for program continuity is so important.
So yeah, that was a lot, but we'd love to move into question and answer. Here, please feel free, to reach out to us. I'm gonna drop the link in the chat to this resource spreadsheet that we made. Let me know if that doesn't work. But yeah, do you have any questions? We'd love to chat.
Thank you so much, Jess and Sarah, for this very needed presentation. Folks, if you have any questions, send them into the chat and I'll read them out.
Thank you, Shay. I'm gonna stop sharing so I'm like, if that's okay.
Yeah,
I'm
of
like, I
course.
want to see people, even if, oh my gosh, I see some friends on the call. This is so nice. Hey, Chris. And if you don't feel comfortable asking any questions now, I dropped our emails in the chat. Please reach out.
We have a question from Carrie asking, did you feel like you needed extra support after you helped the person at your work, Jess?
Yeah, definitely. I think I really appreciate what Sarah said in terms of like management needing to take on that responsibility. Um, I didn't necessarily feel that support from management. I think I felt it from my peers because we had other folks that were in the room as well, helping that patron. And so, I feel like I often would look to my peers for that support. But I think for me in that situation, I think I just wanted an acknowledgement for management, like, wow, that was really intense. Are you okay? You did the right thing, those affirmations. I think a lot of times, and I feel this way about myself too, working in the public library, sometimes we get a little jaded, right? We're on like go mode, we're in survival mode. And even for myself, sometimes I would feel like I wouldn't have that time to just pause and reflect. So I think having that time to pause and reflect and have that with management as well would have been really helpful. But I did create those sorts of containers with my peers. Yeah, thanks everyone.
Yeah. Please feel free to reach out to us. We are really into the subject. We would like to see more libraries adopt this. So we're here to be a resource for you. So if there's something you want to ask or set up a phone call or a meeting, please do so.
Absolutely. And right now I'm working at NC State University, so I'm working on this more and now I'm very focused on digital equity right now, but I'm still in this field and working on it through the NC State lens, thinking about like how can this exist on an academic on a campus, what's needed, how can academic libraries be involved. Um, so I'm still in this field. Um, Also give a shout out to our state librarian, Michelle Underhill. She's also very interested. We've been talking about how we might do a statewide survey to sort of see who who carries Narcan, who does harm reduction training, things like that. Trying to figure that out also with, not diving too deep into scope creep. I'm like, that sounds like a PhD project. And I'm not in a PhD program, but if folks are interested in like being a part of that, or yeah, be in touch. We have a lot of great librarians across the state who do this sort of research in public health as well. We're working with Dr. Noah Lenstra at UNCG as well. So yeah, thank you again so much.
Yeah.
All right, folks. Well, we'll wrap up and the virtual keynote will start at 11. Thank you so much, Sarah and Jess, for making yourself available. Folks, do reach out with questions. It's definitely good to have this community approach to this issue. But thanks, everybody.
Thank you. Have a
Thank
great
you.
rest of your week, everyone.
Bye.